for recreation, dedication, hard work, plus patience. To some more of my sacrifice, I'm done waiting. Told you that I wasn't playing. Now you hear what I've been saying. Dedication. Dedication. Look.
Hey guys, so I wanted to do a video with something on because every time you all see me, I'm probably in a faja, a waist shaper, or I'm probably just having on this and that because I'm getting my massages done. So I wanted to show you all just how I look with clothes on. So again, I got Phaser 360 lipo all around. I did not do anything to my butt, which some people think I got my butt done, but I didn't. My Dr. Garcia at Imagos Plastic Surgery in Miami, he just contoured me really well, and he contoured my back really well so my butt stands out more. And you'll see my before pictures, I'll add that on here. The day of my surgery, I was 229 pounds, and my waist was 47 inches. Yes, 47. Now I am 223 pounds, and my waist is 34 inches currently, and my waist will go down. My goal weight is 180 pounds. My goal waist is about 28 to 30. I'll be happy with that. So, and I got a breast lift, no implant. Again, you'll see the before pictures of my breast. This is my breast lift, no implant. I just wanted them up and more full. They look amazing. And all of my tape has come off my breast, so they feel normal. I have the sensation back in my nipple. They're nice and soft. They feel normal. The size of my waist is the only thing that's tender as of right now. I am 4 weeks post-op, and my waist is a little tender, but that's gonna go down with time because that's where they took, really took out a lot of fat there. And with my massages, that'll go down. Just so you know, it takes about 3 to 6 months for you to see your results completely when you get lipo. That's continuing with you eating right and working out. As long as you don't, just eat crazy and do nothing crazy, you're going to see the results you desire. So when you are able to work out, I highly recommend at least doing cardio, meal prepping, at least doing some form of workout so you can, maintain your results. Because keep in mind, with lipo, doctors are just taking out fat, right? Fat do come back. Fat can come back. Basically, you're getting a fresh start. You're getting a do-over. So why mess it up? It'll be a waste of money and a waste of time, right? Nobody wants to keep going back to get lipo. It ain't cheap, right? So definitely do what you have to do. You can follow Elite Style Fitness on Instagram. That's a fitness company. That's where I get all of my fitness belts from. And you definitely want to start looking into fitness. So after when you're post-op and you're able to work out, you can start having a fitness regimen. Because I'm going to get this waist down. And also, it's normal to have like a pudge here. Even people with the most abs still have a pudge here. So after you get lipo, it's normal for this pudge still to, if you can see it, for this pudge to kind of, still be here. This is still kind of a little tender right here, but my massages help that. That's normal. That's going to go down as long as you do what you're supposed to do. That is going to continue to go down. Continue to compress. Don't eat crazy. Because let me tell you this, just because you're compressing, don't mean your stomach's gonna go down if you're eating crazy, right? Like if you're just eating fast food every day, snacks and chips and all that, and you think, oh, I just got lipo, I can do that as long as I'm compressing. No, it don't work like that. Yes, you're compressing, but you have to watch what you put into your body, because if you're putting unhealthy things in your body, that's going to generate fat, and this will never go down. So you have to kind of, watch what you eat still, and obviously compress. So I am 4 weeks post-op as of October 23rd. And right now, I no longer have to wear the foams if I do not want to. My doctor said, obviously it's up to me, but I don't have to. I just have to continue to compress. At this point, if I do stop wearing the foams, my doctor wants me to find something to compress that's seamless, because he don't want me to have the indentions from the fajas. But you know, I'm probably still gonna just wear the foam right here so I can still wear the fajas with the hook, because I feel like the seamless shapewear doesn't compress me enough unless I put like on a waist shaper or something like that, which is obviously you can do, because once you put those on, they tend to stretch out and you're not being as compressed. So I don't have to wear the board or the foams at this point if I don't want to. But I got Vaser 360 lipo, and a lot of people have been asking me what's the difference between that and traditional. I'm gonna say this again so I can say it in every video. Traditional lipo, just look at it this way. They poke you, 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 poke you. Vaser lipo, they put, I don't know, that you have incisions, they put like a light, that's my best way I can say it to make y'all understand. Something like a light, it melts the fat completely to liquid, and then they put another tube in you that probably has like a couple holes on it, and it just sucks the fat out. It's no poking like that. So after my Vaser lipo, I had minimum bruising. I only had bruises where my incisions were, and I wasn't in that much pain. I actually was sore. I was able to go to the mall within 2 to 3 days. So this is something I tell people you should know and you should ask your doctor. Depending where you're going to get your surgery at, the state. In the United States, there are legal requirements of how much fat you can take out of someone at any given time. That's because your body needs fat to survive. So the difference between why people go to the Dominican Republic and Colombia, besides it being cheaper, they can take out as much fat as they want to. They're not legally bound to take out. They can take out however much fat you want them to take out. They can take it out. They don't have any restrictions there, which isn't a good thing for me, because I know your body needs fat. I have heard of people going there, getting their surgery, and coming back to the United States and not doing so well, because you have to have fat in your body. You just can't take out as much fat as you want to. That's why here in the United States, they have restrictions. If it was safe, there would not be no restrictions here. But obviously it's not safe, right? So in the state of Florida, they can only take out, I would just say equivalent to 9 pounds of fat. I think I'm not sure what that is in liters, 4,000, I don't know. But Google it. But in the state of Florida, I know they could take out whatever, in liters, whatever is equivalent to 9 pounds of fat at one given time. So my doctor, for my Vaser 360 lipo, he took out whatever he could legally take out, that's what he took out. So he took out about 9 pounds of fat for me out of my Vaser 360 lipo. Google your state or ask your plastic surgeon how much fat can they take out you legally at one given time. I saw someone post in Facebook about why people going back to get lipo and things of that nature. So if they're getting it in the States, let's just say, and they go to somewhere like Florida, and you only can take out 9 pounds. You take out the 9 pounds, you may not get the results, you heal, and then you can go back and take out another 9 pounds. So you only can take out a certain amount of fat at one given time here in the States. So that's why people go to Dominican Republic and Colombia, because you can take out live fat out of here, you take out fat out of your legs, all over your body, and it doesn't matter how much it is, you can't do that in the States. So definitely be mindful of that when you're booking these procedures with these doctors out of the country. Like, just really, really, really be mindful. Just be mindful, okay? I don't want to get, me personally, I don't want to get surgery nowhere where I don't speak the language. And I don't want to get surgery nowhere where if something happens to me, my mama can't get to me, my mama can't speak to nobody, and they don't have the tools and the medicines that's needed to save my life. That's just me, but to each his own. If people want to go to Dominican Republic, go to Colombia, I pray for you, but anything can happen obviously here in the States too. That's why you have to research your doctors. Don't go to these little chop shops because they're cheaper. Research your doctors. I'm not saying that nothing can happen to people here. It can. So that's why you research your doctor. My doctors are board certified. Their facility is hospital grade. Their anesthesiologist has been doing this for over 25 years. So like, I did my research for my doctor, Dr. Garcia, Imagos plastic surgery in Miami. Like, he has over 20 years of experience. I did my research. Do your research. Ask those questions. And make sure you know how much fat can be taken out at one time, because you might go into surgery thinking that, oh, I'm about to just be all snatched up, and your doctor can only take out 5 pounds of fat and you really need him to take out 10, right? And nobody told you that. So make sure you ask that. Ask how long the anesthesiologist has been doing their job. Ask your doctors, are they board certified? Ask them, will they be doing your surgery in a hospital grade facility? Ask them, how long have they been doing surgery? Ask them, have they had any deaths and or complications from anyone that they have done surgery on? And if so, when was the last time? What was the end result? Like, y'all have to ask these questions. Y'all paying y'all money, and this is y'all life that y'all putting in other people's hands. I asked all of that. My doctor, I didn't play. I asked them all of that. My doctor record is clean as a whistle. Like, they work with hospitals. My doctor, who did my breast lift, who did my surgery, he works with hospitals in Miami because he works with breast cancer survivors. He's a reconstruction, he specializes in reconstruction of the breast and basal lipo. He worked with breast cancer survivors. So doctors at hospitals recommend their breast cancer survivors to him for reconstruction of their breast. Like, you have to ask these questions. If you don't, you're only hurting yourself. Trust me, ask these questions. Don't look for the most popular doctor. The most popular doctor don't mean the best doctor. The cheapest doctor don't always mean the best doctor or a good deal. You get what you pay for. And also, the most expensive doctor don't mean the best doctor. You just have to ask questions, and please, y'all, do y'all research. There's so many girls not doing any research, just going to anybody, going to doctors in a strip mall next to a grocery store just because they're cheaper. If you can get, this is just me being real with y'all, if you can get your boobs done, a tummy tuck, and a BBL all for $5,000 to $6,000, run. It ain't no way. You should not be able to get 3 procedures for $7,000 or $6,000. It shouldn't happen. It should not happen. Shouldn't happen. I'm just saying. Breast lift alone is about $4,000 to $5,000. Lipo alone is about $4,000 to $5,000. Even if they're giving you a deal, come on now. Like, I paid for my breast, and my lipo was $10,000. My doctor gave me $2,000 off. I paid $8,000 for my surgery and $4,500 for facility and anesthesia. The facility and anesthesia will vary depending on the person. My surgery was 6 hours, right? Because I got a breast lift and I got 360 lipo, so they have to kind of turn you around. And my doctors, they take their time. They ain't got girls coming in and out of there where they rushing you. No, they don't do that. It's 2 doctors in the office. The day of my surgery, it probably was 7 people. They probably had 7 surgeries that day between the 2 of them. And keep in mind, not all surgeries take a very long time. Some people just getting a 3-hour surgery, a nose job. It depends. But do your research, ladies. So that is why people go to the Dominican Republic, to Colombia to get their surgeries done, because they don't care how much fat they can take out. I mean, they just want to be snatched. That's not what I want. I wanted to be snatched, and I wanted to come back home to my son, and that's why I did the research I wanted to do. So I'm happy with my results. 9 pounds off of my stomach is a lot. Like, I feel like I can manage the rest. I feel like I don't have to, I'm a 34-inch waist. I don't have to go back and get more lipo. Yeah, I can go back and have him, take out about 3 more pounds, maybe take out the rest of this, and I'll be snatched to the gods if I go back. But I'm not trying to pay no more money for no lipo. Guess what? He gave me a fresh start. I can work this out. This is going to go down more, and as long as I eat right and work when I'm clear to work out, do what I have to do, I'm going to be snatched to the gods. Okay? Snatched to the gods. But do y'all research. I kind of just want y'all to see how I look in clothes, because I know y'all tired of seeing me in that dang on faja. This is my butt. No, for the 100th time, I did not get my butt done, because I see y'all ask me that in the comments. I can't reply to everybody. I did not get my butt done. My doctor just contoured my back here, and so now my butt is just out. That's all he did. Oh, and when you get lipo, make sure you tell your doctor you want to be contoured. Not all doctors are going to contort you. They're just going to suck out the fat. What that means is that they focus more on your waist than they do on your waist and here kind of than they do anything else to give you that contour look. They make sure they really do it, like really give you here. So make sure you say you want to be contoured and do your research, okay? I cannot stress that enough. Do your research. Sometimes getting your surgery done in the States might be a little more expensive than going to Colombia, DR, wherever. It might be worth it. I'm just saying, do your research. I paid for my surgery, half finance, and I paid the rest in cash. And you can do a payment plan, but definitely do your research. Please, I'm begging y'all. I have heard so many stories and unfortunate stories of people, and that was my biggest fear. But I love my doctors. My anesthesiologist was the best. They're just amazing. So yeah, I just wanted y'all to see this and kind of explain to y'all why people opt to go to DR or Colombia instead of the States, because of how much fat can be taken out and why people continue to get, continue to get lipo, because there's only so much fat you can take out at one time legally here in the United States. So if you have any questions, comment below. Make sure you subscribe to my YouTube channel, imperfect_fits_Toya. Make sure you follow me on Instagram, imperfect_fits_Toya. Also follow my fitness page at Elite Style Fitness. So when you're ready to work out, we have the fitness belts for you, the waist shaper, we have the fitness bomb clothes. So when you're ready to work out and so you can maintain those results, we got you. So make sure you just comment below if you have any questions. Message me if you have any questions, or follow me on Instagram and DM me, because I can't answer all of the questions at the bottom. But thank you so much for all the love y'all have been giving me. It's greatly appreciated, because this has been a long journey for me, and I'm so happy with my results and how I look, and I know you all will be. Just, be wise about the decisions you make, the doctor that you choose. And yeah, continue to be positive and uplift one another. And I'm going to always be here to uplift y'all, because we need some bomb results, okay? Some bomb results. So I just want to show y'all this, and thank you. Cute, right? It's coming along, It'll be there. It's coming. It's coming. All right. Bye, y'all. Thank you.